Hello everyone. One of the things we come across in plastic surgery is scars, scar correction, scar revision. This is indeed one of the most frequently asked questions to plastic surgeons all over the world. It's one of the most common procedures. I didn't make any video about this until today. I was surprised about it. There are many things to tell about this. And I have taken notes on my blog notebook. I'll take a look from here, so there's nothing left because there are a lot of things to tell. I think this video will be a little bit long, I guess. Now, first of all, the most confusing thing is this. What's a wound and what's a scar? Patients do not realize that these are different things. For example, a patient calls me and says, "Doctor, I had an accident. 2 days ago, I had a motorcycle accident and there's a scar on my face." And they say, "I want to fix it so that there are no scars." Now, there is one thing. We, of course, make careful sutures on a wound and we do skincare and all, but the patient had an accident 2 days ago. His stitches was done at the hospital and the wound began healing. Now, this is not a scar yet. We can't talk about a scar at the moment. There's only a wound that is being stitched up. This wound needs to heal and leave a scar behind. It must have been healed, closed a while ago, and left a scar behind. And then we can talk about a scar. Patients often want to have anesthetics done when they have an accident or even on that day. Now, the day you had an accident, there can't be done any aesthetic revision. The thing to do is to suture the wound properly, clean it, perform the skin care and wound care. You need to distinguish between scar and wound. If there's no scar left behind, we cannot make a revision on a scar. Why? Because we usually make an extra incision in the tissue during the revision. We perform Z-plastic and V-plastic. Extra stitches are placed on the tissue. And incisions are made in a wound with a patient. The thing that can be done in an emergency hospital is to clean the wound. Before anything, that wound needs to heal and close. If we perform an operation that requires an incision such as a Z-plastic or W-plastic at the moment, the circulation of the wound lips with impaired circulation may be further impaired. So, the wound needs to be healed at the beginning. It will be cleaned nicely and wound care will be performed. The stitches will be taken out. Those stitches will be removed when the time is right. How much time will it pass? At least 6 to 9 months. The hardness on the tissue will be softened, a redness will fade. Only after that we can perform the revision. First of all, I can say that after 6 or 9 months, but without the correction, we cannot make any revisions. Sometimes a year passes, but the tissues are still hard. Our criteria here is that the tissue is becoming soft. Pathologically, if we take a piece of cells from there and examine in biopsy, we would see that wound is still healing within 2 years. Look, the whole wound actually heals in 2 years on average. Actually, it may take a little longer. But it softens enough to allow surgical intervention only after 9 to 6 months. The healing of the patients, on the other hand, wound is very important. In some, wounds are healed very hardly, leaving bad scars. 6 months have passed, but it's still hard there. Then we will have to wait. There's something asked a lot. Razor marks on the arms. Look, this is very, very difficult mark to fix. I don't take any action on this because the razor itself is something like a scalpel anyway. There's a scar in the thinnest possible way. Also, the scars with razor are really bad. In the back of the arm, the inner part, performing aesthetics in these areas don't give very good results. the scars will stay. Let me be honest, I don't do any procedure for the patients for this problem. But there are procedures that can be applied, such as abrasive operations. Such operations may fade the scar a little bit, for example, laser application. If you apply laser application, there's no guarantee, but the scar might slightly fade away. Razor scars on the arm is really one of the hardest marks to fix and fade. Actually, it shouldn't be done at all. As I said, it is also bad in terms of location. It is a place that leaves a mark. Maybe patients may benefit from laser. Since I don't have much experience in this, I cannot say much. But don't apply to us for surgery because we are not going to do a surgical procedure that will really benefit this. Patients often apply for the officer exams, the police exams, because in these exams, it is required that the person has no visible marks on the face and other visible places. In other words, if the patient has a stitch or a scar on his cheek, it is impossible for us to completely make it disappear. You should know about this. Let me tell you once, no scar completely disappears. It's not possible. However, it can be very faded, it can be a more acceptable appearance. Maybe, let me give you a tip, it can be completely hidden using a light foundation. But it's not possible to make it go away completely, especially in a visible location such as face. Sometimes the patient comes up with a really bad scar. We tell him it's not possible to make it go away completely. I tell him to forget about the exam. With that scar, no matter how much we fix it, you will not be able to pass the exam. Sorry about that. It's sad, but no scar is gone 100%. There's no such thing. What we can do is to do the scar revision, making the scar as less noticeable as possible, fading it. Like I said, bring it to a state that one can wear a light foundation to completely make it disappear, but it's not possible to erase the scar using surgical methods. It doesn't exist. Now that I mentioned foundation, I actually made a video about this. You can find it on the website hastaokulu.com. There's something called camouflage makeup. Now, surgically or with a laser, peeling and such methods, it is possible to lighten the scar to a certain extent, but that, as I said, it's not possible to have it go away completely. Let's say there's a very faint scar. It is not possible to completely remove it, but you can hide it. There are makeup products that cover these scars. There are quite thick foundations. You can apply these. Also, watch my video about camouflage makeup. I explained in detail there. But this is not our job. Don't come to us for camouflage makeup. Makeup artists can teach that to you. They can provide you with necessary materials. You need to contact a good makeup artist for that. Surgery can help you to a certain extent. The rest can be done with makeup. It is important why the scar is bad. There are many reasons why a bad scar is left behind. Simply, on the day of the patient's injury, maybe because of the wound is not suitable, maybe for other reasons, for instance, an animal bite, the wound may not be stitched. Animal bites don't usually get stitched up. The wound is left open to heal, the wound is dressed, so there is no infection growing inside, of course. It will leave a bad scar. If the wound is not stitched, the scar will remain bad. We might have been obliged not to stitch the wound. Like I said, this would be something like an animal bite. It might be a very dirty wound that can become infected. In such cases, the wound is not stitched or covered. Open dressing is done. And of course, the scar will be very bad. First of all, it is desired that the wound heals properly and there's no infection. Then after 6 to 9 months or 1 year, revision is considered. It will be planned according to the situation. But first, recovery must be completed. A second reason is that the wound was stitched. but with an unfit material. It is stitched with a very reactive thread maybe. It leaves a bad scar, or it is very stitched badly. Rough stitches are made. It may be stitched very tightly. Maybe there was a defect in between. A piece of tissue just was lost. You close the stitch, but it's very tense. Such wounds also heal badly. The wound needs to close loosely for a good healing. Apart from that, the stitches may have been removed early, so the wound opens up again. When this is the case, it is not usually stitched back again. It is left to heal by itself or stitched, but the stitches taken out really late. For example, a stitch that should have been removed after 15 days was taken by the patient 2 months later. It leaves a bad scar. Apart from that, sometimes the patient's body is very important. In other words, if the patient's body is prone to leave a bad scar, the scars will heal with a hypertrophic scar, or keloid may occur in the patient. In such cases where keloid occurs, it is very difficult for us to explain the patient in the beginning. This is purely based on physical phenomenon. For example, a few weeks ago, a male patient of mine, whom I performed a penis enlargement surgery, developed a keloid. I have been performing these surgeries since 2004. I have operated on hundreds of thousands of patients, but I have never seen a keloid in that area on the upper part of the penis. It could be 1 in a million. Of course, I explained it to the patient. This is something regarding the body. We stitch the same way each and every patient. We use the same technique. But that guy had a keloid. When there's a keloid, it is possible to fix it. It has its own techniques. It doesn't disappear completely, but it can be made very thin. If keloid occurs, we need to explain it to the patient. That's something related to the body. If you pay attention to what I have listed now, I will count them even more. There are 1001 factors that affect wound healing, but turning into keloid due to the bad suture or an infection is not something usually seen. Conversion to keloid occurs because of the physical attribute of the body. For example, when the patient's body is prone to that, let's say he gets a piercing in the ear, sometimes such keloid is formed in the earlobe as large as the ear itself. It is like there's a mass as big as an ear hanging under the ear itself. See, these things are the things we cannot foresee. It is up to the person's body. Now, there's something like this. I said hypertrophic scar, I said keloid. What's the difference? Hypertrophic scar, wound is healed, but poorly healed with a swelling. The scar is prominent. You can fix this. Keloid is different. The wound heal that now occurs in the keloid, the reactions are so severe that the body exaggerates the healing event there, so now moves behind the scar. It carries on the normal tissue, it becomes a puffy, hard, itchy mass. And unfortunately, keloid is a problem we see once in a million, and that it is self-induced. If this happens, it can be corrected. It can't be made completely vanished. For example, cortisone injections are given, the keloid is reduced and softened. After that, a large piece can be taken out from the keloid and the edges can be stitched and reduced. Let me tell you one more thing. I'm not talking about hitting the knife on the outside of the keloid, but taking a piece from inside the keloid. If you hit the knife through the keloid and remove a piece from that part, and then stitched up by 1 millimeter on the 2 sides, the keloid becomes thinner, smaller, and doesn't repeat. But if you say you are going to remove the keloid and then you hit the tissue next to it, you hit the knife and clean the tissue, the keloid will repeat itself. That's why the keloid doesn't go away completely. You take a piece out of it and you leave 1 millimeter long keloid tissue on both scar lips. You stitch it up and it doesn't repeat. The patient will benefit from this. As I said, the cortisone needle of soften this. Plus, one advantage of the cortisone needle is removing the itching immediately. This is an advantage. In general, the scars on dark skin tend to get worse. For instance, in black people, for instance, it's usually bad. In lighter skin races, there's a thinner, smoother wound healing. There's one important thing. It would be better if I said it in the beginning, actually. One of the most important factors affecting the scar is whether the scar is consistent with the skin's lines. Simply, you have lines on your forehead, all horizontal, because of the way the muscles work, the lines from horizontally. Now, a scar on the forehead would be very obvious if it were vertical, because its lines would be vertical. A stitching mark shows itself very clearly. But let's say the scar is horizontal, then it gets lost in the forehead lines. It becomes less obvious. What type of advantage give to us this situation? Let's say the scar is perpendicular to the skin lines. We make it fractured using methods such as Z-plastic and W-plastic. So a vertical pattern, when it gets broken like this, fits the forehead lines. And the look of the scar is much vague. If it is against the skin lines of the body, we can make this scar fractured and parallel the lines. I'm going to put a couple of photos in this video. You'll see it there. This is one of the most frequent aesthetic revisions done. W-plastic, Z-plastic, double reverse Z-plastic, running W. Using these, we can get improvements. Apart from that, infection causes the scar to sit badly. So when the wound comes to the ER, you need to clean it throughoutly. Still, sometimes it is not possible. I remember very well a patient who was in a traffic accident, who had severe wound on his arm and face. We put in the OR room, cleaned it up. But you need to see what comes out. You had to see it. Dust, soil, plant pieces, grass, weed, car body paint. Blue-colored pieces came out. Then we found out that the car was blue. The car's body was broken and paint slipped under the skin. So we need to clean these up as much as possible so that there's no infection. Sometimes it's not possible to clean these objects. The scar is very obvious because of these. Those foreign objects stay like a tattoo inside. Who do we see this in most? Unfortunately, this happens with the coal mine workers mostly. There's a grisly explosion, let's say. The face and arms of the patient are injured, but coal dust penetrates inside the wounds. It is not possible to remove them. You usually perform wound care, you cleaned up the stitches, etc. But the coal dust particles penetrated into the skin remain black like tattoos and stains. If it's possible, it is necessary to clean the objects inside the wound. Otherwise, it causes the scar remain distinct. Apart from that, stitch marks tend to remain bad in some parts of the body. It even tends to turn into keloid, for example, on the breastplate bone. If there is something like that, I don't recommend that you take it out because it's very risky to leave a scar. It isn't necessary to follow up the moles there. Just follow. If you see growth or something, if you see a distortion in the shape, then get removed then. But if there's no sign of turning into such malignant thing, you shouldn't touch it. Apart from that, for example, the back, try not to get moles out of the back. Like I said, it is a bad place. In my early days as an assistant, unfortunately, I had removed a few of my very close friends' moles on their back. He asked me, and I said, okay. Unfortunately, sadly, my friend was playing tennis a lot. The stitching marks on his back are always stretched. When he plays tennis and he hits the racket like this, and then he hits the racket and then they get stretched. He leans down and reaches his toe, they get stretched. So the back is not very convenient place for bad scars because it's under constant tension. It's constantly stretching. You'll wear your shirt and your back will stretch as you button up. You will tie your shoes, bend over, stretch. You hit the ball with the racket, it stretches. You know what I mean? The scars on the back are often bad. It expands. There remains a wider scar than the mole you removed. Well, my friend got rid of the moles, but I honestly suffered a lot of remorse. Patients who want to have something removed from the back, let me be honest, I don't do it. This is what I say, watch it closely. If there's a chance that it will turn into something malignant, then you should take it removed. Then the job is no joke. Apart from that, age affects a lot. For example, the scars are faint in children. Does the child have a bad scar? Those scars will become fainter as the year pass. They will soften and become not visible. So scars usually heal better than the adults. In general, usually, there's no child with a scar staying bad for a lifetime. Adults have the worst scars. Potential for recovery decreases as you age. In addition, there's also something like this. There are some experimental studies conducted. For example, inside the mother's womb, if the child has a lip fracture, it is sometimes treated by endoscopic methods using a camera and a rupture in the lip of the fetus treated before the birth. There are surgeries like this. They did this in the rabbits. They drugged the rabbits. A lip fracture was formed in the baby rabbit in the mother's belly. They went into camera and fixed it. There was no scar in the lip of the born baby. It can be also done for the people, for the human beings. If there's a lip fracture in the mother's womb, it is treated by entering with a camera. I don't know whether it's done in our country. It may be, I'm not sure. And so the scar is left in the baby born. The recovery potential is great. The child has a scar, but very little, and less likely to appear in the adult. In other words, age affects the way scar stays. Apart from that, the blood must be clean for the wound to heal. Scars are worse on the patients who smoke. If the blood circulation isn't very good, the scar will be bad again. In fact, the wound may not heal diabetics. Blood circulation is disturbed in diabetic patients, and the potential for healing of the tissues is impaired due to the high sugar levels. Wound healing can be disturbed. The patient underwent a surgery, let's say, for instance, she had an abdominal lifting surgery. Stitches may be open. I saw such cases in the college, and with the diabetics people, we can have this problem. Other than that, the blood doesn't just need to be cleaned for the wound to be healed. Other things also required. For example, there are some elements that promote wound healing, such as vitamins. For example, calcium, magnesium, zinc, and many other vitamins. These should be adequate in the blood level. If the patient has zinc deficiency or, magnesium deficiency, wound healing can be disturbed. The wound may not close. I've seen such cases in college. Many things were being looked at, tested. The teacher wanted something from us, calcium, magnesium, zinc. He said these should be looked at as well. I remember the patients who had low levels. The wound does not heal because the zinc and magnesium are low. You give them the patient as vitamins, as a tablet from outside, and they get recovered easily. These are also very important. There are places where the scars are good, and let me briefly mention them. For instance, the upper eyelid, the lower eyelid, the stitch marks almost invisible around there. The scar is very vague and heals very beautifully. The face area is like that as well because it's a place with good blood circulation and not very stiff, especially if the surgeon is doing the cut and the stitch scar coincides with the skin lines, then the sure scar may be left in a very, very vague way. For example, let's say the patient has a mole on his neck. When the mole is removed, you remove it taking into account the skin lines, and you have something very vague remain as a result. Apart from that, for instance, the chest, the stitch marks remain beautifully on the chest. You perform the surgery entering from the nipple. It's almost not visible. Tummy tuck scars are generally good. You may have been seeing the cesarean scar. It remains in the form of a very fine line that doesn't hold a bad scar that usually look well. I mean, the location is important for stitch marks. There's an operation very interesting, calf aesthetics surgery, leg aesthetics. Now this surgery, we place a prosthesis behind the knee to thicken, shape the leg into the muscle below the knee. Now this surgery has a very interesting feature. It's written in the books. The stitching scar where you hit the knife on the back of the knee tends to heal bad. That's why it is said start with a bleaching cream before the surgery. I don't think that way. Let me be clear, in my experience, there's such thing. In some patients, the stitching scars really look bad here, right behind the knee. But the reason why they appear bad is the browning of the wounds. That is, I think the browning in that area will improve lightening cream. My observation is this: if there's a slight bleeding when you hit the knife during the leg aesthetics, that blood spreads under the waist, and the iron element in that blood's hemocytes stay black like a tattoo on the skin. It doesn't always happen. I've seen it 4 or 5 patients so far, but there's something like this. After we noticed this, we did the following on the first patient. We began with the color lightening cream. We did the filler injection, cortisol injection. We tried everything. We exfoliated, but nothing went away. That's why I think it's due to the iron. When there's the slightest bleeding, the blood spreads under the skin. The iron element in the blood also sits on the skin and looks like a tattoo from outside. It leaves a dark, thick scar behind. Now, in the patient, we tried everything. We couldn't get any results. Then we told the patient, okay, now we will do something radical. We will remove this dark scar and stitch it again. That's what we did. And such a faint scar is left behind. I mean, almost nothing is seen there. I put pictures of this in this video, you will see. In other words, the patient transformed from a very bad dark scar with no almost scar left behind. Then we began to think something like this. I mean, the reason the color stays dark in this area after the knife hits is iron, meaning the bleeding. There should be no bleeding when hitting the knife in that area. None, not even a single drop. We began to perform the surgery this way. How do we do it? First, we inject the medicine there, a medicine that prevents bleeding. Then we wait 10 minutes after we start the surgery. But if the slightest bleeding occurs with the knife, we immediately burn it. Even the smallest drop of the blood shows its head, we burn it immediately. We reach the muscle without any bleeding. If we do this, the scars left are very fine. They are very vague. I think the characteristics of that region is not that the color tends to stay dark as it is written in the textbook. In the textbooks, it also says that there's a hyperpigmentation. I don't think so. The iron in the bleeding and blood sitting on the skin and it looks black from outside. This calf implant surgery has such a thing. During the incision of the blade in that area, you should not bleed at all while marking that cut. We've been paying attention to this for many years. Interesting thing. And my observation doesn't match what is written in the textbooks. Let me be clear. What is written in the books are different, strangely. That's why the features of the place where you operate are also important. If there's a bad scar left with such bleeding, then you need to do it without bleeding at all. An important point is this. When to perform the scar revision and are we going to do it? Now look, everyone goes to the doctor to fix their scars. Now we say to some that is too early. It's only 3 months past. No scar straightening in 3 months. This is because it's not a scar right now. It is still getting healed. The recovery period should end, and only then we can call it a scar. The minimum 6 to 9 months should pass. Histopathologically, it should be past 2 years. For example, you come and it's been 3 years. Now everything is ready for the correction. Now it can be done. At this point, we have to ask, are we going to do the scar correction? And with what? How are we going to do it? Now, when the patients are far away, so sometimes a man from abroad writes to us, we want a photo, we want a photograph, but the photograph gives us a very rough information. In other words, since the patient is away, we want a photo to give us an idea, but physical examination is the right thing to do because other than the color of wound scar, we also need to see the flexibility of the tissues around. How much tissues are softened? How flexible are they? Is the skin near the scar suitable for aesthetics intervention? These are important things, therefore you must come and get examined. However, if you are overseas, we ask for photos because sometimes patients do send photos, but these photos are really fake. We cannot do anything. I mean, there will be no improvements. Or, for example, the patient sends us photographs. The stitch mark is completely opposite to the skin lines. For example, there's a vertical scar on the man's forehead. Then, of course, we can perform an aesthetic operation. If enough time passed, then come and let's fix it, right? But sometimes, as I said, the patient comes for an examination. We check. The scar is so obvious. Here, it is necessary to make a decision. Will the patient benefit from the procedure or not? If the patient will not benefit, then you must send the patient away. For example, camouflage makeup can be recommended at that time. Nothing can be done with surgery. The wound has healed well enough. We cannot do anything on top of that. The thing to do is to slightly camouflage it. We can say that you can cover it with a makeup or foundation and send them away. Or the patient comes, we look. The scar is okay, it has healed well. But for example, it is opposite to the skin lines. We can make this even more invisible. Then what do we think if the patient benefits from the surgery? If we think that the patient will benefit from the surgery, we plan the aesthetic revision. Therefore, we usually want to see the patient here for an examination. If he's far away, he can send a photo so we can get an idea, but the final decision can only be made when we see the patient in person. Of course, as I said, after enough time has passed since the foundation of the scar. So, what is being done in the revision? Now there are surgical methods. There are non-surgical methods as well. Non-surgical methods may include peeling, laser, dermabrasion, and such abrasive methods. Apart from that, we make corrections using surgical methods. Here is the W plastic, Z plastic, double reverse Z plastic. There are many ways to correct. Sometimes it's good to just take off the scar and stitch it back again. Let's say the scar is white, the stitching is open or not stitched in the ER, but the direction of the scar is good. For instance, it is in the forehead as a horizontal scar, but the residue has healed since it was not stitched. In these cases, for instance, it would be sufficient to remove the scar and stitch it with a thinner yarn in accordance with surgical rules. Sometimes the scar is very bad. It is very white. Well, maybe it would be better if you took that scar and patch it again to the skin. Skin patching is also a scar revision method. Other than that, sometimes we remove the scar and shift the healthy tissue from the side. You can even do something like this. You put a tissue expander close to the scar, a balloon, silicone balloon. You inflate that balloon continuously, here once a week. When the healthy tissue is expanded enough, you remove the scar and discard it into a second surgery. You shift the expanded healthy tissue there. This is also a scar revision method. There are 1,000 methods like that. It is difficult for you to know so much about it. We have been studying them for 6 years now. What you need to know now is this: what is the wound? What is the scar? When and how long does the wound recover? And when can we make a revision on it? How should you go to the doctor? And when you should go to the doctor? You have to go and get examined first. I told you that. What to do with the scar actually concerns your doctor. For us to give you enough information on this subject, you need to have a very long education. And therefore, leave that part to your doctor. What you have to do, as I said, don't talk about the scar revision or anything when it's too soon, because, it cannot be done before a certain period of time. You need to send a photo first. Sometimes the patient sends me an email: "Sir, I have a scar on my face. Will it be recovered?" There's no photo. The patient didn't come for an examination either. I have warned about this many times. I've mentioned this in other videos. There's a decrease in the number of such emails. I think it really helped. Submit at least one photo. If you are far away, if you cannot come, send us a photo so we can get an idea. More than that, we need to touch it. You have to come for an examination so that we can see the flexibility of the surrounding tissue. Know this and it's enough. I guess I said everything I have to say on this subject. Oh, there is one last thing. It is very interesting as well. Patients ask me sometimes, "Doctor, do plastic surgeries, but there are no scars. How does this happen?" For example, the man says he has a nose job and he has no scar. Friends, every surgery leaves a scar. Every time you hit the knife, it causes a scar. If the patient who come to me wants to have a surgery without a scar, I say to them, this is not something that I can do. That's a job for Harry Potter at Hogwarts. Abracadabra. Otherwise, there's no scarless surgery. There's a scar in every surgery, but because we hit the knife from a hidden place, and there's no visible scar left. For example, the nose job is done throughout the nose wing. Since it is made from the inside of the nose, there is no scar. Otherwise, there's a stitch mark there. Getting fat from the cheek is done from inside of the mouth. There is no visible scar. Facelift, on the other hand, it is done on the edges of the ears. It remains a very light scar. It heals well. You won't see it either. There's no such thing as a scar-free surgery. There's no such thing as a surgery without any scars. Another thing that is perceived as if it were a bad thing. Okay, it doesn't a good form on aesthetics point of view, especially if it's against the lines. As I said, there could be a very serious distinct scar. But scarring is also a natural thing. Let me tell you that too. It's a residue left over from the wound healing, It doesn't turn into cancer. It's not a bad thing. Also, there's no such thing as being late for the scar straightening. The patients ask me, am I too late to get it fixed? There's no such thing. The more time has passed since the injury, the better. The wound is now healed. The residual tissues remaining from that healing, meaning that the scar is softened, the redness has passed, the surrounding tissues have softened. The edema is gone. Scar revision will now be better. So there is no such thing as being late. On the contrary, the later is done, the better. After 2 years, the wound healing no longer continues at the cellular level. After 2 years, it is already taken its final form. After saying this, I'll end the video because there's not much to tell. I explained almost everything, the subjects I took notes about. If you still have anything to ask, please send me an email or you can ask through WhatsApp message. I will answer at the earliest opportunity. I'll get back to you. And I would like to thank you very much for watching.